Reclipsen is a combination hormone medication used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, this medication may also make periods more regular, decrease blood loss and painful periods, decrease the risk of ovarian cysts, and treat acne. However, it does not protect against sexually transmitted diseases. Before starting to take Reclipsen, make sure to read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. Choose a time of day that is easy to remember, and take your pill at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. Follow the manufacturer's directions for your brand. Continue taking this medication exactly as prescribed by your doctor. Do not skip any doses. If you have vomiting or diarrhea, you may need to use a backup birth control method. Follow the directions in the patient information leaflet and check with your doctor or pharmacist for more details. Taking this medication after your evening meal or at bedtime may help if you have stomach upset or nausea with the medication. You may choose to take this medication at another time of day that is easier for you to remember. No matter what dosing schedule you use, it is very important that you take this medication at the same time each day, 24 hours apart. Ask your doctor or pharmacist if you have any questions. Your pill pack contains 21 pills with active medication. It may also contain 7 reminder pills with no medication. Take one active pill once daily for 21 days in a row. If you are using a product with 28 tablets, take an inactive pill once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. After you have taken the last inactive tablet in the pack or gone 7 days without taking an active tablet, start a new pack the next day whether or not you have your period. If you do not get your period, consult your doctor. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking this medication on that day. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ask your doctor or pharmacist about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. If you experience nausea, vomiting, headache, bloating, breast tenderness, or swelling of the ankles/feet, these are common side effects of Reclipsen. You may also notice vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, contact your doctor. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential risks. While many people using Reclipsen do not experience serious side effects, it's important to monitor your blood pressure regularly and inform your doctor of any high results. Be sure to seek immediate medical attention if you notice any lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, yellowing of the eyes/skin, or any symptoms of a serious allergic reaction. This may include rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of potential side effects. If you experience any other effects not mentioned, be sure to contact your doctor or pharmacist for further guidance. If you are over 35 and smoke cigarettes or use tobacco, you should not take Reclipsen. Smoking increases the risk of serious side effects such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. It's important not to smoke or use tobacco while taking this medication. Before using this medication, make sure to tell your doctor or pharmacist if you have any allergies to estrogens or progestins, or if you have a medical history of certain conditions. This medication may also affect your blood sugar if you have diabetes, so be sure to monitor it regularly. Additionally, if you have surgery scheduled or will be confined to a bed for a long time, talk to your doctor as you may need to stop this medication temporarily. It's also important to be cautious of sun exposure and vision problems while taking this medication. And if you are pregnant or breastfeeding, consult with your doctor before using Reclipsen. Drug interactions can alter how your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Reclipsen include certain medications used to treat chronic hepatitis C, hormonal birth control, drugs used to treat seizures, HIV drugs, and St. John's wort. Some drugs may cause hormonal birth control to work less effectively, leading to a risk of pregnancy. It's important to tell your doctor when you start any new drug, and discuss if you should use additional reliable birth control. Also, inform your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. Reclipsen may interfere with certain lab tests, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you are taking this medication. If you suspect someone has taken too much Reclipsen and they are experiencing serious symptoms like passing out or difficulty breathing, it's important to call for emergency help. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. Symptoms of an overdose may include severe nausea, vomiting, and sudden or unusual vaginal bleeding. It's important to not share Reclipsen with others. While taking this medication, make sure to get regular physical exams and medical tests such as blood pressure, breast exam, pelvic exam, and pap smear. Follow your doctor's instructions for examining your breasts and report any lumps right away. Be sure to keep all medical and lab appointments, and consult your doctor for more details. If you miss a dose, check the product package for instructions. You may need to use an extra method of birth control, like condoms or spermicide, to avoid getting pregnant. If you have trouble remembering to take your pills, talk to your doctor about trying a different type of birth control. It's important to store Reclipsen at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it comes time to get rid of any expired or unused medication, be sure to consult your pharmacist or local waste disposal company. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.